One of the most common concerns men have, but rarely talk about openly, is the strength of their erections. Many men notice that sometimes their erections feel strong and firm, and other times they feel weaker, softer, or harder to maintain. This can create a lot of anxiety and many questions. Is something wrong with my body? Is this normal? Am I losing testosterone? Is this related to age, stress, or lifestyle? And perhaps the most common question of all, can erections actually be improved naturally? If you search online, you will find thousands of solutions, supplements, pills, exercises, pumps, herbal remedies, and even extreme methods that promise to completely transform sexual performance. Some websites claim there are secret exercises that can dramatically improve erection strength. Others suggest specific foods, testosterone boosters, or miracle products that claim to restore erections instantly. But the real question is, what actually works according to medical science? Because erections are not simply about sexual arousal. They are the result of a complex interaction between the vascular system, the nervous system, hormones, psychological factors, and overall health. In fact, many people do not realize that erection quality is often one of the first indicators of general health. The penis is supplied by very small arteries, and changes in blood circulation can appear there earlier than in other parts of the body. This means that erectile function can sometimes reflect what is happening in the cardiovascular system, hormone levels, metabolism, stress levels, and lifestyle habits. In other words, erections are not only about sex, they are about health. And the good news is that many of the factors that influence erection quality can actually be improved naturally. Things like blood flow, exercise, sleep, stress management, hormone balance, and nutrition can have a profound impact on erectile performance. However, it is also important to separate myths from reality. Many of the things people try are based on misunderstandings about how the penis actually works. So in this video, we are going to explore the real science behind erections and explain what you can actually do to improve erection quality naturally. We will talk about the most important factors that influence erections, the lifestyle habits that make the biggest difference, and what medical research tells us about improving erectile function. And before we continue, let me quickly introduce myself. My name is Dr. César Noval. I am a plastic surgeon and medical director of Clínica NEF. I specialize in penile enlargement surgery and gender affirmation surgery, and our clinics currently operate in Spain, Mexico, and Miami. In this channel, we focus on medical education about male sexual health, penis anatomy, erections, testosterone, and many of the questions that men around the world search for online, but rarely receive clear scientific explanations for. So if you are interested in understanding how your body actually works and how to improve male sexual health from a medical perspective, you are in the right place. One of the most common concerns men have, but rarely talk about openly, is the strength of their erections. Many men notice that sometimes their erections feel strong, firm, and easy to maintain, while at other times they may feel softer, weaker, or more difficult to sustain. This variation can create a lot of questions and even anxiety. Some men begin to wonder whether something is wrong with their body, whether they are losing testosterone, whether age is affecting them earlier than expected, or whether their lifestyle might be responsible. The truth is that erections are one of the most complex physiological processes in the male body. They depend on a delicate interaction between blood vessels, nerves, hormones, psychological factors, and overall health. Because of this complexity, small changes in any of these systems can influence erection quality. What many people do not realize is that erections are actually one of the most sensitive indicators of a man's overall health. If you search the internet for solutions to improve erections, you will find thousands of claims. Some websites promise miraculous supplements that supposedly increase erection strength overnight. Others promote specific exercises that claim to transform sexual performance dramatically. There are also devices, herbal remedies, hormones, and countless other methods that claim to improve erections naturally. However, the key question is not what people claim works, but what actually works according to medical science. In reality, erections are primarily a vascular phenomenon. This means that the ability to develop and maintain a strong erection depends mainly on the quality of blood flow to the penis. Inside the penis, there are two cylindrical structures called the corpora cavernosa. These structures are made of spongy tissue that fills with blood during sexual arousal. When a man becomes sexually stimulated, signals from the brain activate the nervous system, which releases nitric oxide in the penile arteries. Nitric oxide relaxes the smooth muscle of these arteries, allowing them to dilate and increase blood flow dramatically. As blood flows into the corpora cavernosa, the tissue expands and compresses the veins that normally drain blood away from the penis. This compression traps the blood inside the erectile tissue, creating rigidity. When this system functions properly, erections are firm and stable. However, if blood flow is reduced, if the arteries cannot dilate effectively, or if the veins fail to retain blood, the erection may become weaker or more difficult to maintain. This is why erectile function is closely linked to cardiovascular health. In fact, the arteries that supply blood to the penis are extremely small, much smaller than the arteries that supply the heart. Because of this, problems affecting blood vessels often appear in erectile function before they appear in other organs. In many cases, erectile dysfunction can even be an early indicator of cardiovascular disease. For this reason, improving erection quality naturally often begins with improving cardiovascular health. Regular physical activity is one of the most powerful ways to improve blood circulation throughout the body. Exercise improves endothelial function, which is the ability of blood vessels to dilate properly. It also increases nitric oxide production, which is essential for the erection process. Aerobic exercise such as running, swimming, cycling, or brisk walking can significantly improve vascular health. Studies have consistently shown that men who engage in regular physical activity have better erectile function compared to men with sedentary lifestyles. Exercise also improves metabolic health, reduces inflammation, and enhances overall circulation. Body weight is another important factor influencing erection quality. Excess body fat, particularly around the abdomen, is associated with hormonal changes and vascular problems that can negatively affect erections. Adipose tissue contains enzymes that convert testosterone into estrogen, which can lower the levels of circulating testosterone in the body. Additionally, increased abdominal fat is strongly associated with metabolic syndrome, insulin resistance, and chronic inflammation. All of these conditions affect blood vessel function and reduce the ability of arteries to deliver strong blood flow. As a result, maintaining a healthy body weight can significantly improve erectile performance. Even moderate weight loss can lead to measurable improvements in erectile quality. Sleep is another factor that is often underestimated. Testosterone production follows a circadian rhythm, with most testosterone being produced during deep sleep. Men who consistently sleep fewer than 6 hours per night often experience lower testosterone levels over time. Poor sleep also affects the nervous system and increases stress hormones such as cortisol, which can interfere with sexual function. Chronic stress is another major contributor to erection difficulties. The erection process is controlled by the parasympathetic nervous system, which is responsible for relaxation and restorative functions in the body. However, stress activates the sympathetic nervous system, which prepares the body for fight or flight responses. When the sympathetic nervous system is dominant, blood flow is redirected away from the reproductive organs toward muscles and vital organs. This means that psychological stress, performance anxiety, and emotional tension can significantly impair erection quality even in otherwise healthy individuals. Learning to manage stress through techniques such as meditation, breathing exercises, physical activity, or therapy can have a powerful impact on sexual health. Understanding how erections work is the first step to improving them naturally. Many men believe that testosterone alone determines erection quality, but this is not entirely accurate. Testosterone plays an important role in libido and sexual desire, but erections themselves depend primarily on blood flow and vascular health. However, testosterone still plays a supporting role. Adequate testosterone levels help maintain healthy erectile tissues and support sexual motivation. Men with clinically low testosterone levels may experience reduced libido and weaker erections. In such cases, medical evaluation and appropriate treatment may help restore hormonal balance. Another factor that can improve erection quality naturally is strengthening the pelvic floor muscles. These muscles play a crucial role in maintaining rigidity during erections by helping compress the veins that drain blood from the penis. When the pelvic floor muscles are strong, They can improve the ability of the penis to retain blood during erection. Pelvic floor exercises, often called Kegel exercises, involve contracting the muscles used to control urination. By repeatedly contracting and relaxing these muscles, men can strengthen the pelvic floor and potentially improve erection quality. Research has shown that regular pelvic floor training can significantly improve erectile function in some men. Nutrition also influences erectile health. Diets rich in fruits, vegetables, whole grains, and healthy fats support vascular function and nitric oxide production. Leafy green vegetables contain nitrates that help improve blood vessel dilation. Antioxidants found in fruits help protect blood vessels from damage caused by oxidative stress. Healthy fats, such as those found in olive oil, nuts, and fish, support cardiovascular health and hormone production. The Mediterranean diet, which emphasizes these foods, has been associated with improved erectile function in several studies. Smoking is one of the most damaging habits for erectile health. Nicotine constricts blood vessels and damages the endothelial lining of arteries, reducing their ability to dilate properly. Over time, smoking significantly decreases blood flow throughout the body, including the penis. Men who quit smoking often experience improvements in erectile quality within months as vascular function begins to recover. Alcohol consumption can also affect erections. While small amounts of alcohol may temporarily reduce anxiety, excessive alcohol intake depresses the central nervous system and interferes with the nerve signals required for erection. Chronic heavy drinking can also damage blood vessels and reduce testosterone levels. It is also important to recognize that erection quality naturally fluctuates. Factors such as fatigue, stress, emotional state, and physical health can all influence sexual performance from day to day. Occasional variations in erection strength are completely normal and should not necessarily be interpreted as a medical problem. However, persistent erectile difficulties should not be ignored. If erection problems occur frequently or progressively worsen, it may be important to consult a medical professional. Erectile dysfunction can sometimes indicate underlying conditions such as diabetes, cardiovascular disease, or hormonal imbalances. The key message is that improving erection quality naturally involves improving overall health. Exercise, balanced nutrition, adequate sleep, stress management, weight control, and avoiding harmful habits such as smoking are some of the most effective strategies. When the body functions optimally, the vascular and nervous systems that support erections also function optimally. By focusing on overall health rather than quick fixes, many men can achieve significant improvements in erectile performance. Understanding the science behind erections empowers men to make informed decisions about their health and avoid misleading claims that promise unrealistic results. If you found this information useful and are interested in learning more about male sexual health, erections, testosterone, and penile anatomy from a medical perspective, consider subscribing to the channel. Thank you for watching, and I will see you in the next video.